decision. Why don't you offer pinnaplasty surgery to patients under the age of 18? Literally because the clinic can't treat people under 18. Simple as that. It is not unusual to do pinnaplasty. Pinnaplasty being prominent ear correction. It is not unusual to do prominent ear correction or pinnaplasty on children. Again, you want to wait for the child to say, please, can I have my ears fixed? You don't want to. You don't do it just because the parents don't like the look of the ears. The child has to request it, and usually sort of 5, 6, 7 is kind of a normal age, I would say, for doing pinnaplasty. So it's, again, utterly reasonable to do pinnaplasty on children, and it is widely performed. But several years ago, when we were going through the process of CQC approval, even though we had a specialist pediatric plastic surgeon, specialist pediatric nurse, there was so much other red tape to go through to get children to be able to treat children, and they made such a small number of the patients we saw at the clinic that we made the decision not to apply to the CQC for approval for treating children. So we haven't got approval at the clinic for treating children. We can only treat people over the age of 18, which is why if you're less than 25 or 21, but we ask for ID and things like that, because we have to ensure that you're over 18, simply because children, and as I said, you can argue the 16, 17-year-old, whether they are officially a child. Children need specific requirements of the place where they're being treated, and the doctor who is treating them needs specialist training, and there needs to be special requirements fulfilled in order to be able to treat children. And we have chosen not to go through the process of that. So we personally can't do pinnaplasty on patients under the age of 18, although it can be done. As I say, if you can find a facility and a surgeon who is approved for operating on children, it's quite normal to have pinnaplasty under 18. As I say, 5, 6, 7 is quite normal for pinnaplasty.